We're going to start today with a great panel. We're going to talk about the Rare Disease Advisory Council and the various roles that we find. So helping the rare disease community includes ensuring that patients and families have a voice in government. Rare Disease Advisory Councils serve to evaluate and make recommendations to the state on issues like healthcare access and coverage for rare disease patients. And we believe that it is time that the New Jersey policymakers are guided by the appropriate local members of the rare disease advocacy community through the establishment of this New Jersey Rare Disease Advisory Council. So we have a great panel of speakers that have prepared to speak briefly about some of the different professional roles that will be appointed to the New Jersey Rare Disease Advisory Council. And we really want to encourage a dialogue so we can plan to leave some time at the end for some questions. So to start us off, I will speak briefly about the role of the pharmacist on the council. So today's pharmacists are positioned as one of the most accessible healthcare professionals and are critical partners in the process of treating pain and mitigating adverse events. The role of the pharmacist goes beyond the pharmacy counter and has evolved to provide a variety of services for the health of both rare disease individuals and the overall community. Over the past 4 decades, the role of the pharmacist has evolved from an individual who was primarily responsible for safely and accurately distributing medication products to patients to an individual who works side by side by physicians, nurses, and other healthcare professionals in sophisticated, highly specialized practice settings to assure appropriate medication therapy management. The role of the pharmacist plays in optimizing patient-centered, personalized, advanced medication management therapy, especially within state Medicaid programs, is vital when building sustainable therapeutic models that partner various medical doctors in order to optimally serve the rare disease community and add value to the care of rare disease patients. So as most of us are aware, rare disease patients are among some of the most clinically complex and often consult with a variety of different medical doctors in an attempt to develop a treatment regimen personalized to their specific needs and condition severity. So as greater importance is being placed on successfully transitioning the care of patients between specialists and post-hospitalization medical sites, pharmacists are in a unique position to significantly improve the quality of care and reduce the financial implications of poor transitions of care from one medical site to another. So as a PharmD, myself and a rare disease person, I believe pharmacists play a significant role in closing the weak links in today's highly vulnerable healthcare ecosystem of which the rare disease patients blindly find themselves navigating. And that is it's vital to have a pharmacist to be appointed to the New Jersey Rare Disease Advisory Council to lend their expertise in improving rare disease matters within the state of New Jersey.
In our society, one of the biggest needs is for transportation, equal access, and other things, like housing, big topics that we're seeing in this political environment right now in our country. Transportation that's affordable and accessible, public or private or otherwise, is something that makes accessing healthcare incredibly difficult. And when you have a rare disease, it's as Nadia mentioned, there's less resources, there's less data. It's more specific for what your needs are going to be depending on what the implications of your disease pathology is going to be. What I didn't mention is durable medical equipment is also something Medicaid covers. Out of pocket, my wheelchair would cost me $110,000. So for coverage, I think it's absolutely necessary, obviously, that we have either regulations or price controls on the corporations and the companies that make this durable medical equipment. And these are things that a Rare Disease Advisory Council would ideally be able to guide legislators on enforcing regulations and discussing with patients the different perspectives, like the inability to work a regular job, the inability to get married to their life partner, the inability to have a consolidated family. I'm 5 months pregnant, I'm due in July, we're both very excited about our future family. But it's also, there's a lot of balancing that goes into that as a rare disease patient, as a person with disabilities. And unfortunately, this is a fight that we're still advocating for a level of equality. This is also something that, many of the families and the other adult individuals that I advocate with as an SMA patient, as an SMA advocate, that I tell their stories and I share their stories. And we basically lift each other up, and we're looking forward to an advisory council, a rare disease advisory council that has this patient, this integral and most important patient perspective of adults living with these rare diseases and how they're able to have independent lives and contribute to our communities. This is something that I'm looking forward to a Rare Disease Advisory Council in New Jersey being able to guide legislators on these important initiatives, on these important laws, protecting our rights as equal citizens, so that we can continue to live in our communities, not have to face institutionalization, and not be subject to discrimination, which is ultimately what not being able to have a job or a family or get married to the person that you love amounts to.
As I mentioned, newborn screening was developed for PKU, and by the time the newborn screening test was developed, there was already a low protein or low phenylalanine diet in place, which meant that once diagnosed, people could have normal or near normal outcomes if they stayed on the diet. So although we had early mandated diagnosis, we have a treatment, we seem to have a lot of advantages. We also have 2 FDA-approved therapies. The reality in PKU, even if you get something on the newborn screening, or even if your screening results come back in time, is that it is still incredibly difficult to manage the disorder. And insurance coverage is unreliable at best and unavailable at worst. So we're left with the current situation. About 16,000 people were identified since the onset of newborn screening with PKU, and about 7,500 of those, nearly half of them, have been lost to follow-up, which means they are experiencing brain damage day after day. They are getting worse, they are getting sicker, they're not able to participate in society. Pregnant women are particularly at risk if they don't have their medical nutrition. The children they bear may have microcephaly, heart defects, low birth weight, and there's also very high miscarriage rates in the PKU community. So even though the disorder is treatable, treatment is not accessible, not effective for everyone. In New Jersey, there's about 1,000 people with PKU statistically, which means about 500 people with this disorder, which we identified, which was named in 1939, and since the 1960s we've been testing for it. 500 New Jersey residents are getting sicker every day because their care is not properly managed. And I think that everyone who's spoken before me has beautifully made the case that we as a state need to better support the rare disease community. And the success we had with SMA is amazing. There are still other disorders on the federal panel that we don't test for in New Jersey. I'd love to see the council advocate in that in cooperation with the Newborn Screening Council in New Jersey. And then there are tests for things like homocystinuria, which is also tested in every state, but the test that we use misses up to 1/3 of cases, and those people don't realize they have the disorder until they go into a health crisis, have strokes, go blind. We as a state, with biotech, can push forward for better testing and more integrated testing across disease states. And I think I'm about the 5th person to mention that there are 7,000 rare diseases, and 1 in 10 of us have rare disease. I think what we've shown, and we have more people to speak, but we each have our own narratives, but we have common needs. And those needs are what the Rare Disease Advocacy Council will bring together, and they will allow us to inform our legislators about all these different arcane, complicated aspects of our medical lives, so that when they make laws, we can be at that table. Thank you.
Now, I cannot feed myself, dress myself, bathe myself. I need help getting out of bed, going to the bathroom. I have problems swallowing, so I'm at high risk of aspirating on my own saliva. So basically, being alone could kill me. My parents' health is almost as bad as mine. My girlfriend works all day long. So, anything under 84 hours of PCA care per week is putting my life in jeopardy. I've had applications that were lost or forgotten and constantly been denied every step of the way, and how everyone around me is suffering because they have to fill in the gaps, and how everyone around me is suffering because they have to fill in the gaps. Very special treatment. We're not asking for any advantages in life. All we're asking for is to be on the same playing field as everyone else. Because I can't tell you how many friends I've lost because of the same lack of care that I'm facing now. And I know Kristen is going through the same thing. This is not a unique story. And people all the time come up to me and they say, "But Steve, you're an actor. You're on television. How could this happen?" And I have to remind them, it doesn't matter what I do. Me being on television does not change my needs. And I know this is depressing, and I'm truly sorry for that. But this is what we go through every day. It's 2020, and we still have to beg for the basic care that we need just to live. And until we are able to get a council like this, we will continue to die.
Thank you, Steve.
Thank you.
Like such a few, because according to the definition, a rare disease is defined as one that affects fewer than 200,000 people, but yet millions around the globe, right? And you do have to be able to know what's going on with everybody so that we can help as much as possible. Honestly, one statistic I had is 1 in 20 people will live with a rare disease at some point in their life. That seems to me to be a lot. That doesn't seem to be a small number. And anything we can do to try to help and be able to understand more of the diseases that we might not know about, I appreciate, because we learn. I just feel like none of us know enough about everything, that's for sure. And I will never say that I know everything. So without you coming to us and explaining to us some of the things that you go through every single day, we're not going to know. So I again appreciate all that you do and what you have to honestly deal with in terms of health insurance and your situations in family life and trying to work and trying to take care of your children, doing all those things. I appreciate it. I can understand. I had a harrowing experience this morning. When chocolate milk going all over the floor before I left to go out and trying to get the kids to school. That's a lot for me to handle when I'm trying to rush here. So I can only imagine what you all go through, especially if you have someone in your family with a rare disease. So again, I appreciate all of you being here. Please always feel like you can reach out. You can be on today. Make sure you take down my number, get someone from my staff. I'll make sure you can get a card. But I will want to hear from you in the future as well. Thank you so much.
Again, my name is Dan Benson. I'm just really happy to be joining here with my fellow colleagues. And I want to thank the hosts for having this again. But most importantly, I want to thank you for coming out. You're out here because you are already a leading advocate or representing a company that's there to help make our lives a little bit healthier and better. So I want to thank you for the work that you do. I've partnered with many of you. You heard John mention. I want to thank John so much for his advocacy. He testified before the Health Committee, maybe 6 years ago, maybe 5. And we struck up a partnership with him along with Tony from the ALS Association, and went forward from there and really were able to get a few things done along with Senator Troy Singleton on the funding side and making sure services continued. But most of us really get introduced to rare diseases because a constituent or an advocate like you reach out to us. Once in a while we'll have somebody in our family or a family friend where we learn about a rare disease, but usually it's a constituent that comes into the office. So for me, not only was it John, but it was Ryan. Ryan was a little boy who at the time was diagnosed with Duchenne's muscular dystrophy. And so a new organization, his parents, one a teacher, one a cop, in my hometown of Hamilton, started Ryan's Quest. And along with that group, and many of you know this, you partner with a whole bunch of other groups across the country so that you can pool your money for research or to help with patient services, whether it's just helping with things like transportation to the next clinical trial, or it's just helping share stories of how to get insurance coverage for things that you have. I pride myself on being an advocate for this community and a resource, whether you live in my neighborhood or not. As a member of the Health Committee and Budget Committee, I'm really excited that we're going to push the Rare Disease Advisory Council bill. I think having that group voice representing all the different rare diseases at the state level is so important, because we're still at a time where we're trying to squeeze out every little bit of savings from the healthcare system, and oftentimes those decisions are being made without your voices in the room. And we want to make sure that political expediency in some cases or financial expediency doesn't cut you out of that equation. And we want to make sure you're in the room when we're making a decision, and we make sure we make the decisions that are right for your families and for our communities. And it should be not because you're 1 in a million, or 1 in 10 million, or 1 in 100 million, you're a New Jersey resident, or if you're from neighboring states, you're a resident of the United States, and we're here for you, and that's our commitment. Thank you.
Good morning, everybody. I'm Assemblyman Chris DePhillips from the 40th Legislative District. I have a little laryngitis, so hopefully you can hear me okay. Pleased to be here with my colleagues this morning. We're all committed to this issue. We're all committed to dealing with rare diseases at a policy level. All of us have been impacted by constituents, and we do hear, as Assemblyman Benson said, we do hear from our constituents and families in our districts who are dealing with very rare diseases, and I'm no exception. I've had very painful experiences with constituents in my districts who have dealt with and lost children in the rare disease area. And so it's something that I'm committed to addressing on a policy level here in Trenton. And as Assemblywoman Downey said, we're not the experts here, but we're here to listen and learn and then act. And so that's our job as legislators. And so we're here this morning to listen to all of you, and it's not going to be 3 talking heads talking at you. I think the goal here is to have a conversation with all of you and to listen to all of you this morning. And then we can take those ideas and hopefully turn them into legislation or responses to those issues and solutions, hopefully. This is about solutions. So it's our privilege to be here with all of you to listen to your stories. You can certainly ask us any questions if you'd like, but we do want to hear from you and then have you educate us so we can go forward working together with you.
So my name is Heidi Ross. I'm the State Policy Director at NORD, so I'm actually based in Washington, D.C. I'm really grateful you guys took the time to join our group here today. From your experience as legislators, what's the best way to advocate to you guys? Where I think it's really intimidating sometimes to go and speak with your legislators. Can you tell us a little bit about what you see as some of the best ways to engage with your legislators and advocacy?
And if you don't, I'll just say that I'm always willing to have people come into the office. I love having people come into the office so we can have a real conversation. But you can speak to, anytime you see me, please feel free to reach out. But please make an appointment, come into my office. And again, just what the other assemblyman said, it doesn't have to be that you're in our district either. I'm happy to speak to anybody throughout the state about any of the issues and be able to help. Besides being an attorney, as you heard, I also have my master's in social work. It's extremely important for me to know that we have the right resources that are available to all of you. And as an attorney, I fought against insurance companies to make sure that people get protected. And I want to advocate on that end too. I'm also part of the AFI committee, so financial institutions and insurance. And I want to make sure that whatever the issue might be, we can advocate for that. So if it's a problem because of private insurance companies, if it's a problem with Medicaid, whatever the issue, just let us know. And I feel like most everybody here would agree, make an appointment, come see us, because we really do want to talk to you and hear what the issues are, so we can solve better.
Yeah, I think it sort of amazes us from time to time that people are intimidated by us because we're actually, Our job is to be public servants and to be representatives of all of you and our constituents. So please never hesitate to reach out to us. That is our job. And as Assemblywoman said, it doesn't matter if you're in my district or not. These issues cut across the entire state. They are not political issues. They're not partisan issues. I'm a Republican. I'm sitting up here with 3 Democratic friends. It doesn't matter. These are not political issues. So, and it's not one camp versus the other. I think we can get aligned around the strategy beyond politics, beyond party, and I know all of us are committed to that. I think in terms of making an impact on us, it's hearing from those real families, those real people in our districts that are suffering one way or another with a rare disease. And I had an 18-year-old boy in my district who grew up with my own children die of a rare disease. It's called NUT, midline carcinoma. It's a very rare form of lung cancer that normally strikes teenagers, normally around age 17, and normally boys. And that's exactly what happened to this boy, Ben Landau. And so the family, who I've known for years, came to me and my colleagues in the 40th Legislative District. We introduced a resolution to raise awareness of that particular disease, which is deadly, pure and simple. Exactly what the literature said would happen, happened to him. He lived 9 months with the disease. And so we've been working with this family for now 2 years. He died in January of 2018. We're working with this family to continue to raise awareness of this disease. And we're talking about one disease. I mean, there's many diseases represented here. So that's our job, is to listen, learn, and act. So
I just want to welcome Assemblywoman Nancy Pinkett, Chairwoman of the Environmental Committee. She has been active in healthcare issues her whole professional life and been a great advocate on many of these issues. Do you just want to just say some other things as well?
Well, I'll just say, healthcare's not, obviously, looking at like the coronavirus, right? Right now, we can see that healthcare is very fragile. It's something we take it for granted. Over the years, we've made so many improvements in healthcare that we think everything's perfect, and it's not perfect.